you've done the INBDE?
I have.
Yes. So how was that experience for you?
I did the INBDE right after the AFK, so it was. I don't want to. It was easier.
It was easier.
It was easier. Yeah.
Would you say?
It was just.
Some people are going to think like,
it was a different
I'm
level.
failing this exam.
No, like, yeah, that's not it.
Yeah.
The content is basically the same, but the questions are more direct.
Superficial, direct.
Yeah, more superficial.
Not
as
kind of
well.
like
no tricks. Just like that's what they want to know. Like the classic symptoms, they're gonna throw it there. Like for Paget's, they're gonna go. My dentures no longer fit. Oh,
I feel like if I do it, I would pass, but.
You
I could say that.
You should do it. You should take it. You should take it.
Well, you did the AFK course.
Yeah.
Right, with scholars. Then you went to the INBDE.
Exactly.
Did you do any extra preparation there to?
Not extra preparation, but I did take like some online quizzes. I found the INBDE
like
boot camp.
Based.
Yeah, US based, just to see if the exam format was too different. And it was. So I was like, okay, let me just take a look at this. Mm-hmm. And I took those quizzes, but for like 2 weeks.
And then that's it. And you made
And then that's it.
So INBDE is easy. You could say
after the AFK preparation,
yes.
So if you prepare, like if you do a course for AFK, if you're like good for AFK, you're great for INBDE.
Yeah. Like AFK is the heavyweight. You're going for AFK.
Yeah. It's like you're over prepared for INBDE, so it's good. It's always good.
But if you're not preparing for AFK and you're going directly to INBDE, yes, you could fail.
Oh, I think it's difficult. It's 2 days of exam. A lot of questions. The content is basically like virtually the same as the AFK. So it's 4 years of the industry.
Yeah.
So you can't say that it's easy, but after preparing for the AFK,
it becomes kind of a piece of cake. Simpler.
Yeah.
More likely to pass.
Yes.
Right? And there's no scoring for it.
Like our students, everyone who passed the AFK and took the INBDE, they passed. Mm-hmm. Both, right?
Facts.
We can't deny facts. So
far, everyone that took the AFK course with us and eventually took the INBDE, I never heard anyone that failed. Everybody passed. So it is like objectively, you could classify it simpler.
You can find more people who self-studied for INBDE and had good results.
And passed.
But you don't find people who self-studied for the AFK and passed.
Yeah. I mean, you could find
except for
people. You could find people, but the people are not like, it's not a majority number.
Oh, yeah. Like very rare. Very difficult to find someone. I only know you, honestly.
In the past, it used to be where, like people would study the release questions.
And that was enough. Yeah, I heard that. That was
and they used to get lucky.
In the past.
Yeah, because they used to repeat a lot of the released.
Oh, wow.
Right? But now it's the released are, since the time they voided that exam and during, I think it was during COVID times. So then they kind of refreshed the way they bring the questions or.
Yeah, but it's still like the same questions in a different way, right?
Yeah, for sure.
Right? The content is the same.
The content is the same. Maybe they a little bit, at that point, we went through, it's interesting how we went all through all this change, like the perio change happened.
Oh, yeah.
During that time.
Some changes happened.
I think that was around 2020 when they started implementing.
It can make things more a little more confusing, maybe.
They started implementing more of the rest, though. But yeah, it was before, in the 2010, between that and 20-something, like in the teens area, like that time, where it was like, some people did the release and just passed. And then it still wasn't easy. Because you could get lucky, like, you have to get lucky still.
Yeah.
But now, I don't know, it's really difficult.
Even for the INBDE. So maybe like back then, the level of the AFK and INBDE was similar? You could say maybe. Because INBDE is not easy. It's not like easy.
Yeah, it's
even
not
if you self-study, like it's not going to be easy.
Yeah, but if you take an AFK course,
it's going to be very, very unlikely.
Yeah.
To pass, to succeed, right?
Very unlikely.
Self-studying for the AFK.
Okay.
Like if you self-study for the AFK, it's going to be very unlikely.
Yes. We had a survey actually, and I think it was 15% chance of passing. Yeah.
Wow, that sounds high.
Sounds
high though.
But that was like, there could be some margin of error because people may be replying to the survey could be only people that have taken a course. And so to find the people that did not take any course and failed, it was harder to include those people in the sample. right? Because
Yeah.
we just, put it out there on social media and like fill up this form. If
Yeah.
you taken, this was a while ago. Can't remember exactly which year, but I could check that. But it was maybe in 2019 or 18, 2019 probably. But we put that out there okay, if you took this exam, we collected the data. From that, we got, if you didn't take a course, 15% of them passed. I think it's probably realistically lower.
Yeah, I think
If
it's
you
lower.
find the people that actually didn't
Never
Yeah.
took any course.
any
yeah.
preparation. Yeah.
Yeah.
Taking a course is always better than taking no course. Doesn't matter which course. It's
Yeah,
like
100%.
at least taking a course is better than nothing.
Yeah,
And then which course you could do your research,
100%.
book consults. We do that here
Yeah.
too. Right? I want to circle back to the INBDE and just go like understand the exam. Do you remember the exam structure?
Yeah, it was like there's images, so not like unlike the AFK where it's just text. The INBDE, there's images, there's
some
radiographs,
cases.
there's like patient like cases. So like
Still one
kinda
answer
like
though. Only one answer.
one answer
Yeah.
though, but it's kind of like what the ACJ, like an ACJ question would look like, but with one correct answer.
5 options.
Exactly.
Whereas ACJ could be 15
Multiple,
options.
yeah.
and multiple, correct. Yeah.
So yeah, and also I think it makes it easier when you look at images, right? So think about the AFK. Like it's really hard for pathology,
Yeah.
for example. Like you have to memorize, how each lesion, like each condition looks
It's like how they're described.
looks like
Lesion-
not looks like, but how they're described.
How described to text.
Yeah,
That could be like dual, like, because if there's a keyword you're looking for, then it makes it
True.
easier.
yeah,
But because sometimes the image, if they bring you a confusing image, but also if they
on
bring
ACJ you mean
huh?
on ACJ or INBDE, or it doesn't matter.
Just in general, like if they bring you an image and the image is not clear,
Right.
then it makes and they don't bring any supporting text with it. It could make it more difficult.
Right, but no, like for INBDE, for example,
They're a
there's
classic.
image and some
text.
description, and text and some
What did you
description.
drop?
My phone. It's fine.
It's okay.
There's a
It'll
case.
survive. Yeah.
It will survive. Yeah, it's used to it. But yeah, so there's image and text. So like,
for
doesn't
example,
that make it easier?
They bring like a linea alba. Sorry, not linea alba. Let's talk
That's-
about
yeah.
leukodema. There'll be an image, and then
They're
they'll
gonna
tell
say,
you that
oh, when
disappears
you
upon
stretch.
stretch.
Yeah.
Yeah, that's
So like, how can you get that wrong?
INBDE.
After you put it, so easy.
INBDE is
No,
yeah.
it's
seems
not.
like
It's not easy. It's just
It's easy after AFK.
after AFK, 100%. Yeah.
Yeah. I think that's good information so far
Yeah.
that people could use.
And you should take the INBDE.
Is it a challenge? Like
It is a challenge. I'm challenging you. You should. No, you should.
when I get some time, I just
You know,
right
like-
now I'm so busy. But
Don't you like taking tests? I feel like you do.
I enjoy. But
Right?
one day if we get 100,000 subscribers,
100,000. No, let's get like 1,000 likes.
you have to sign a petition. Like
No,
take
1,000
INBDE.
likes.
1,000
Dr.
likes.
Hafez must take the INBDE.
Oh my God! After yeah,
It's fair.
it's a time
fair
thing.
though.
I mean, I think it'll be fine.
I think so.
I'm pretty sure. Yeah, I could pass.